Good afternoon and good evening. Welcome to this Frontline Events panel on vaccine diplomacy. I'm your moderator, Michael Bociurkiw. It is now 11 a.m. on Thursday, April 29th, where I am in the Pacific Northwest, 2 p.m. in New York City, 7 p.m. in London, 8 p.m. in Brussels, 9 p.m. in Moscow, and 11:30 p.m. in Delhi. These are the locations where our distinguished speakers are based, and I will introduce them shortly. I'd like to remind you, thank you again for joining, is that we will be taking questions later on in the panel from you, our distinguished audience members. You can put in for a question by clicking the live question, by raising your hand on Zoom, or by leaving a written question in the comments box. And a reminder that a recording of this panel will be posted later on across all Frontline social media channels and on YouTube, and no better time than now to subscribe to the Frontline YouTube channel. So the title of this panel is Vaccine Diplomacy, and the capital of one of the largest vaccine manufacturers in the world, Delhi, is on its knees as the COVID-19 pandemic, taking advantage of several vulnerabilities, including clearly a lack of political will, sickens and kills hundreds of thousands of people. India, along with China and Russia, and a growing list of other producing countries, are engaged in vaccine diplomacy to bring life-saving doses to less privileged countries, or to those that can afford it. In a bid to showcase their own global health leadership, the three superpowers are donating millions of doses to countries, but often with strings attached, which are not always evident to the recipient countries. And yet all three, it seems to me right now from the numbers I've just seen, have pretty low vaccination rates. For example, many people in India need to pay for the jab, or they show up for appointments and they find out it's canceled. The COVID-19 pandemic marks the first time in modern history that all of humanity is experiencing the same invisible public health menace all at once. The pandemic has now sickened over 149 million people worldwide and killed almost 3.1 million, 500,000 of those in the United States alone, and hard to believe, but approaching in Brazil, 400,000. The United States has 32.2 million cases, and India is in second place with almost 18 million. As the infectious disease expert and member of President Biden's COVID advisory panel, Michael Osterholm, told me, COVID-19 is like a forest fire looking for human wood to burn. The pandemic has revealed deep fractures in the multilateral approach to vaccine distribution. We'll be talking about this, with production hoarded or even blocked, and with many countries left to fend for themselves. Amid the unprecedented demand for vaccines, there is also intense competition for scarce resources or inputs that go into making the vaccines. And this hasn't been in the news very much, but it's starting to take hold. So there's a growing shortage of lack of resources or inputs for the vaccines. And to put the current challenge into perspective, pre-COVID, global vaccine manufacturing capacity was about 3.5 billion doses a year, and 5 billion if you include the seasonal flu shots. This year, for COVID vaccines alone, manufacturers have scaled up new capacity from 0 to 10 billion, doubling world vaccine capacity of what is a very complex process in a matter of months. In short, everything now seems more political, and the pandemic is no exception. So the panel of international experts and journalists will discuss the current dire situation, starting with the worsening situation in India, the hidden costs for countries accepting vaccine donations, how soft power is being flexed, and what the playing field could look like in future pandemics. Yogita Limaye is the Delhi correspondent for BBC in New Delhi, covering India and South Asia. She has also reported from the Middle East, South Korea, and the United States. Dr. Syra Madad was featured, many of you may recognize her, in the Netflix series Pandemic. She is a nationally recognized leader and epidemiologist in public health and special pathogens, preparedness, and response. working in the largest healthcare delivery system in the United States in New York City. Welcome, Doctor. Teri Schultz is an experienced multimedia journalist covering NATO and the European Union. She is heard frequently on National Public Radio here in North America and around the world, and on Deutsche Welle, among other outlets. Professor Steve Tsang is a longtime friend of the Frontline Club. He is director of the SOAS China Institute at the University of London. He maintains a major focus on mainland China, Hong Kong, and Taiwan. And his last book, correct me if I'm wrong, Professor, is Governing Hong Kong Administrative Officers from the 19th Century to the Handover to China. Last but not least, Anna Nemtsova. Hi, Anna, привет. Permanent Moscow correspondent for the Daily Beast. She has also contributed to The Atlantic and other publications. And aside from Russia, covers neighboring former Soviet states. And I think the last time we saw each other was in Ukraine. So let's kick off. A few hours ago, I had recorded a chat with the BBC's Yogita Limaye in New Delhi. She brings us the latest from the front lines and also provides some wider perspective. So we'll roll that tape and then we'll go to the live distinguished speakers. Thank you. Yogita Limaye, thank you so much for being part of this panel, especially taking time out during these very crucial and busy times for you there in Delhi. Can you just bring us up to speed? A lot of people have been seeing your reporting, and again, we salute you for everything you're doing there, bringing your skills to the story and empathy. What is the latest from the ground there in Delhi at the moment concerning the crisis?
Well, the situation actually still remains extremely grim. We haven't really seen improvement on the ground in the past 10 days. Since we've been sort of outside hospitals and crematoriums covering it. What you're still seeing every day is people struggling to find oxygen, hospital beds, struggling for ICU beds. So, when I wake up every morning, my messages are flooded with people asking for help. When you open Twitter, I'm sure everyone is seeing that. And, even on the streets, I've actually been seeing people who've just brought their family members in the back of their cars, in the back of auto rickshaws sometimes literally hunting around, going from place to place to get, any kind of medical attention. And sadly, in front of us, we've seen in the past week, people sort of collapsing during that hunt, not even being able to, they're not even, there's not a chance even for them to be saved. So yeah, people are dying of COVID-19 in India, but a lot of people are dying because they're not getting the medical help they need on time.
Yeah. Now, we saw you reporting about all of the foreign aid coming in as well, but Daryl, I'm almost afraid to ask this question, but is it going to get quite a bit worse before it gets better?
What we saw in India, even during the first wave, was that different regions of the country peaked at different times. I've had a lot of people ask me, is the worst over in Delhi? It's really hard to say because, it's not, at this point, as I said, it's not just about how the virus is spreading and people getting severely sick from it. It is people who could be saved, who are dying because of a shortage of medical care. And so it's really kind of hard, I think, even for epidemiologists, even for doctors, to put their sort of finger on when are we going to start seeing the number of deaths fall. And what we are currently seeing in India is very worrying surges from many other parts of the country. So Uttar Pradesh, which is one of the most, well, it is the most populous state of the country. We're seeing a really worrying surge in cases in many areas of that state, from the state of West Bengal, where you had election campaigns going on until just about a week ago. Again, we're seeing really sharp spikes in COVID-19 cases and deaths from there. So I think what is very clear for everyone who's working on the ground here is that this isn't ending soon. There's going to be weeks, maybe possibly even months of difficulties ahead.
Sure. And as we saw when the United States was the hot spot, I mean, people can add a lot of inputs, oxygen, beds, these sort of things. But if you don't have the skilled bodies there to treat these patients, it doesn't make that bit of a difference. So it leads me to the question, with all of this foreign aid coming, does India have, or Delhi specifically, the absorptive capacity to take this and actually deploy it sensibly and in an effective manner?
Well, I think what needs to be done right now, it needs to be done on war footing. What we're seeing unfolding in front of us is a disaster, and it needs to be treated like one. Yeah. So what we need to see happening on war footing is capacity being built up, field hospitals, somebody trying to assess where is the next peak going to happen, which part of the country is going to be badly hit, having field hospitals there with at least oxygen facilities, even if you can't immediately sort of put in an ICU there. But as you rightly pointed out, this is not just about equipment and supplies. I mean, those are extremely short as well right now. So, you have hospitals in this city and other parts of the country who are saying, we've got patients, they're going to die if we don't get oxygen supply. So those are extremely critical, but you need doctors and nurses. You can build up as many hospitals as you want, but if you don't have people with the right skill set, that's not going to help save lives either. So this needs to be an effort which is on war footing to build up new facilities, to identify the locations where you're going to need them in the coming weeks, but also, and I'm not exactly sure how the international community can help in this, but there is expertise. There are doctors, there are nurses all over the world. We see them fly in when you've got big disasters like earthquakes, yes, or cyclones, for example. And if we have that coming in, that will certainly help the situation on the ground.
Yeah, and I guess the timing is terrible in the sense that so many other jurisdictions are just in crisis mode as well. Even here in Canada, we don't have enough doctors and nurses. So I wanted to ask, as many people know, India is one of the biggest vaccine manufacturers in the world. And yet we're hearing reports of people actually on the ground there in India not even able to get vaccinated because there are localized shortages. What is the situation there, as you said?
It was always going to be a challenge, even if India is the world's biggest vaccine maker. Look at its population. It's 1.3 billion people, 2 doses each. That's more than, that's around 2.6, 2.7 billion doses of vaccine. Even if you say, not the whole population, but cover a significant chunk of it, that's still, we're talking about a mind-boggling number there. It was always going to be difficult, but I think there were a lot, precious time, over the past 3 months, could have been sort of saved to create more vaccine, because we've had producers in India, Syra Institute, which is the world's biggest producer of vaccine, mass producing the Oxford AstraZeneca vaccine, but also the Novavax vaccine. And they've been talking about a few things that are limiting their capacities. I mean, one, significantly, they talked about funding, and which now sort of in the past week, the government of India has said we're going to, give you $600 million to the 2 vaccine producers in India, who, the vaccines of which companies have been rolled out. But I think the question is, could that funding have been put in earlier to ramp up production capacities? Could Serum Institute, for example, have been producing more doses, from February, from March onwards? The second thing, as they've been pointing out, is the raw material shortage. And again, now we've seen action from the US on that front this week when the situation became really bad in India. I guess the answer really is that, yes, many, many more people could have been vaccinated until now if a few of those things had been fixed.
Right. Now, the name of the panel is Vaccine Diplomacy and Vaccine Nationalism. India is up there pretty much on the level of China and Russia in terms of either donating vaccines to bilateral countries, friendly countries, or selling them. Might that have been an example in India's case of misplaced priorities? In other words, focus more resources on taking care of the problem at home, or as you say, trying to prevent the problem from spiraling out of control, rather than looking at these other countries and trying to help them. And I'll just throw in there that one government minister, I believe, said that, well, if we didn't help those other countries earlier, they may not have come and helped us right now. What's your take on the situation there?
Well, I think every country has to strike a balance to say, if anyone says that, oh, India should have kept all of the vaccines it's producing for itself and not given them overseas, I'm not sure that would have been, looked at as a very good move, partly because, the vaccine we're receiving in India, or the Oxford AstraZeneca one, for example, it was not developed in India. It was developed by Oxford and AstraZeneca. And, this is, it's basically global cooperation, which is helping even us in India get vaccinated at this moment. So, I think, I don't think it would have been a very wise thing to for the Indian government to say, absolutely not, we're not sending vaccine anywhere else in the world. I do think that there needed to have been appropriate planning of how much vaccine India is going to need, according to the pace of vaccination that is possible in the country, to ensure that at least the supply of vaccine is able to keep pace with, how many people you can inoculate in a day, for example. Placing orders with companies. So I think while a lot of countries around the world were placing orders with different companies to procure vaccine stock, some of them excessively so, from what we've seen, much more than their needs are. But I think in India, even now, there is no clarity really of what kind of stock is there, what kind of orders have been placed, what negotiations are going on. Because the situation got so bad, India approved all of the vaccines that have been approved by the US FDA, for example, and some other regulatory authorities around the world. But that doesn't mean much unless those doses are actually coming into the country.
Right. And on the foreign policy scene now, there was a lot of commentary as well about the Prime Minister spending a lot of time on foreign policy as the crisis was spiraling out of control. Either foreign leaders coming to India or him traveling elsewhere. And you already talked about the rallies and stuff like that. But was that misplaced too? Should much more attention have been placed in recent weeks on domestic policy and preventing this from actually happening?
I think there was a sense in India, in January and February, when the daily new cases and deaths dropped dramatically, as we actually saw happen all over the world. When the first wave subsided, all over the world, you had those numbers drop, and then you had, in many parts of the world, a second, much more deadly wave. But in India, you had, for example, in February, the ruling BJP party actually pass a resolution saying that India had conquered the pandemic under the leadership of Prime Minister Narendra Modi. In March, when there were surges being reported from some districts in India, you had the country's health minister, Harshvardhan, say that the pandemic was in its end game in India. So I think there was a lot of, there was this premature sense of conquering something that was really unpredictable in the face of evidence from all over the world that there were, a second surge was almost inevitable. And in that situation, vaccination was only one part of it. I think it's about stocking up on all, the medicines needed, oxygen supplies needed. In some places, field hospitals, which were built up during the first wave, were dismantled. So I think being better prepared. And then, of course, the one crucial thing I think that the pandemic has taught all of us, that, how do you control the spread of COVID-19? And the basic things like, stopping mass gatherings, ensuring there is people follow COVID protocols. And that messaging really needs to come from the top to percolate in a country like India. I think last year, during the first wave, the messaging from both the national as well as sort of state leaders was very consistent about wearing masks, social distancing, not having big gatherings, people really being as careful as they can. And then that just all, seemed to slip away in February and March. And, now India finds itself in this situation.
Okay. Yogita Limaye reporting from Delhi for BBC World on our frontline panel on vaccine diplomacy. Thank you very, very much. Again, we salute your work and please take care of yourself.
Thank you so much. Thanks a lot.
And thank you. We are back. We thought we'd let that roll a little bit longer because it is such a breaking news story. And in the panel, as we'll be talking to our panelists, we'll be talking a little bit about how countries have been over-promising, but it looks like they may be under-delivering to the countries they're sending vaccines to. Now I'd like to go, if I can, to Dr. Madad in New York City. Thank you, Doctor, for joining us. And we truly salute your work, the work your team is doing, frontline health workers all over the world. And I understand as well, you were part of an India task force giving advice to various stakeholders. If we could pick up where Yogita left off, you're so well known along with Bill Gates and others for putting out that warning sign for a pandemic, prepare, prepare, prepare. But what is happening in India, can that be seen as a warning to other countries to be vigilant, especially with the variants of concern becoming more predominant, and to resist declaring victory too early over COVID-19?
Yeah, absolutely. I mean, we cannot go back into the cycle of complacency and we need more humility when we talk about this pandemic, because as you're seeing today, there's a couple of things. First, around the world, these are the highest rates of transmission that we have seen at any point in this pandemic. So we are certainly not over, or we haven't recovered from this pandemic yet, even though some countries, like, for example, the US, are doing much better than others because of their massive vaccination rollout. We cannot say the same for a majority of the countries around the world. We've only deployed 1 billion vaccines in 172 countries, and that's nowhere near where we need to be. And so first, this is, unfortunately, the darkest days of the pandemic around the world. If you look at in the first, in the first 9 months, it took us 9 months to get to 1 million cases, and then another 4 months after that to get to another million. And if you're just looking at India, in the next, past 3 days, they're clocking in over 1 million cases, and that's underreported. We know that just based on last year's data, only 1 in 30 infections were actually being caught. And so now looking at the explosive growth that's happening there, it's much, much higher than what's being reported right now. The other thing that I'll mention is so many people live below the poverty line. And so to have, access to testing and to pay for it based on the ability to pay versus the need is a huge, huge disadvantage, not just in the context of COVID-19, but in everything that we talk about in healthcare. So we really need to look at it more from a strategic standpoint. And particularly for the US, this is in our best interest to help India and other countries, because we know that while we have this really great vaccines rolling out, over 50% of the US adult population has received at least 1 dose. The variants that can emerge in all of these countries will threaten the vaccine-induced immunity that we all have. And so it's not just about obviously helping because it's a humanitarian crisis and that's the right thing to do to see all these people get infected and dying, but also to know that, their progress and the high rate of transmission is threatening all of us. So we really need to make sure that we're looking at it from that lens.
Okay, Doctor. And with the exception of the United States, which is kind of the newcomer vaccine diplomat on the block, if I can put it that way, Russia, China, and India seem to have something in common. They are exporting vaccines, they are donating vaccines, but yet at home, it seems that their own vaccination rates are quite low. What do you attribute that to?
I think there's quite a few things. First, in India, as we know, less than 2% of the population is fully vaccinated, and less than 10% have received at least 1 dose. And I think we just need to make sure that we have the raw materials to provide more vaccinations to the world, and that equity is at the heart of it. We want to make sure we're getting these vaccines to the most vulnerable people, because I think when you look at it, even in the US, we have kind of open season, anybody can get vaccinated. But if you actually truly look at the people that are most vulnerable in driving infections, if we're able to prioritize and make sure they have vaccines first, we're able to have a bigger impact on the total community transmission that is happening everywhere. So we certainly need to look at equity and where vulnerability lies as we look at the massive rollout that's happening around the world.
Okay, thank you for that. We'll certainly be coming back to you. I already see there's a question regarding vaccine passports, very hot topic at the moment. Let's hop across the Atlantic to Teri Schultz in Brussels. Teri, welcome again. Now you've just come back from Sweden. I'd like you to tell us a bit about what you saw there. After all, it was one of the outlier countries in terms of shunning lockdowns, mask wearing, that sort of thing. And then we'll talk a little bit about EU unity, but if you could start with that. You'll have to unmute yourself.
Microphone.
There we go.
I already said the smartest thing with my mic off. No, thank you for having me, even someone who can't remember to turn their mic off. So yeah, I just came back from Sweden, having gone there because yes, 1 year after basically the pandemic really started spreading around Europe, Sweden has stubbornly maintained this policy of not shutting anything down. A lot of people in the US in particular were hailing Sweden as really a hero in freedom because nobody's forced to wear masks. They never shut the gyms, the restaurants, the pubs. They simply gave them earlier closing times. And then a month ago, Sweden had the highest new infection rate in Europe. And so, yeah, it's not much fun to live in lockdown as we've been living in Belgium for so long. But now Sweden is not looking so heroic. And I did interview the chief epidemiologist there, Anders Tegnell, who maintains that masks are not very useful, he told me. And he He actually said that other specialists don't think they're very useful either. So it doesn't look like Sweden will start taking those tougher measures. And still you hear Swedes complaining about when are they getting out of their lockdown. That means letting restaurants stay open as long as they want. So it's certainly a different world if you go all around Europe. And when we talk more about vaccine diplomacy and approaches to this new travel passport and things like that, I mean, there's just wildly different approaches. Remember, Italy, you could walk your dog for a limited amount of time, and in Sweden, you can work out at your gym. So. Yeah.
Now, the EU, and you're in Brussels where they're based, likes to proclaim always that when there's a crisis, they will always emerge better out of it. There'll be certain lessons learned, more unity, that sort of thing. But as we spoke yesterday, there's a lot of division in the bloc. It's quite worrisome. Countries opting out of purchasing agreements, opting out of travel arrangements. The head of the EU, if I'm not mistaken, was quoted as saying that Americans will be welcome if they're vaccinated in the fall. Countries probably going to opt over that. So what does it mean in terms of going forward in terms of unity of the bloc?
That's right. Well, the head of the European Commission was given an interview to the New York Times, and which made it sound very much like Americans would be able to come back to Europe for summer vacations. But you had to look at all the qualifiers in those sentences, which people who want to travel so badly aren't looking at, like likely will be able to possibly come back to Europe. And what she was talking about is the EU's hopes that enough people will be vaccinated on this side of the Atlantic that some countries can open up some areas to some travelers. And that would be fully vaccinated people who can prove that they've been vaccinated. And the other side of that is that the European Commission doesn't make any of these rules. Each EU government, and if there's one message I could leave everyone with, each EU government makes its own rules on border policies and on all medical issues as well. They can be coordinated at the EU level, and the Commission begs them to have sort of a unified approach, but they don't have to. So nobody in the US should start buying tickets quite yet, because so many countries here still have such a terrible epidemiological situation that they may not be opening things up. I mean, we still have curfews here in Brussels. We haven't been able to go to a restaurant in many, many months. We just got our stores reopened a week ago. So, I don't think the Belgians who are not getting vaccinated at a high rate want to see tourists pouring in here.
Okay, thank you for that. We've covered one of the three superpowers, India. I'm debating whether we should go to China or Russia next, but let's go, if we can, to Russia, to Anna Nemtsova. Thanks for joining us. Anna, as we spoke, Russia is a major vaccine diplomacy player. It also appears a little bit behind in vaccinating its own people and runs the risk of overpromising and under-delivering. What does the Russian Federation hope to gain from giving those free vaccine to fraternal brothers and sisters in other countries? Are there strings attached to its donations? And a lot of it's foreign relationships, as you and I have talked, are a little bit unstable or competitive, and might it help to smooth out relations with some countries?
So in the Russian official telling of the pandemic, there's been mostly positive news, and there've been, in fact, some positive news. There are 3 registered successfully, effective and safe vaccines, but the overall picture is not a rosy story. In fact, the numbers of people living in poverty today in Russia are just significantly higher, and the official death toll is relatively low, but the actual picture is different. Russia's excess death toll hit 422,000, which is the world's record per capita. So that is really scary. When Teri was saying that everything is still under lockdown in Brussels, in Moscow, you see thousands of people hanging out together in giant clubs. Everybody's mingling, no masks on, nobody cares, as if there is nothing happening around the world. So during all this month, Russian government was trying to convince both the international community and the nation that we have no problems and everything is great. There's a positive picture, successful work of Russian doctors and Russian scientists. Russia registered Sputnik V in August, right? The President Putin said that is the first ever in the world registered vaccine before the trials were even completed. And the clinical trials showed that it was effective and safe, in fact. But in January, when I got my shot as a journalist, social workers, doctors, everybody who works with people could get shots. So all my colleagues, reporters, got their Sputnik V to be able to work with people. But at that time, in January, people in the regions were dying and many were just eager to get their shots. All of a sudden, we hear news that thousands of dosages traveled to Mexico, of all places, and then to Argentina, and then to Brazil, and then to Hungary, and then to Slovakia. And that was, you know, a surprising news for people. But on the other hand, everybody in Russia wants to be good to the world once in a while. You know, we were told before that Russia is the best to combat drug trafficking, for instance. So Russian officials traveled to Afghanistan, to China, to Latin American countries, and said that Americans cannot fight drugs. We can. We are much better. The same with terror, war on terror, right? Russia in Syria was trying to demonstrate that Russia can actually stop the terrorists and nobody else can. So there is this sense of superiority, a sort of a sign that you guys fail and we are better. But Russians were skeptical all along. You know, it is very interesting. I met with a group of students, 25 people, and I asked them who has been vaccinated, who is going to get a shot. And only one girl, a future reporter, said that she's going to get her vaccine done. Why? Because we don't trust authorities, they said. Why Putin has not got his vaccine? That was the first question. And that was in February. And then nobody could understand why. Well, official answer was because of his age group. Okay, but then when the president finally got vaccinated, we didn't know which vaccine he used, which one of three, Russian or maybe not Russian. So people had a lot of questions and doubts. I spoke with Kamchatka today. They do have vaccine. There is no problem with supply, but they have their doubts. They have their myths. They have their worries. So there are two issues. One is doubts, and the other one is supply. As for the export and the diplomacy strategy, Russia's goal is to sell 200 million dosage and make around $4 billion, right? That's a sort of a business plan of as for now, it's hard to say which the accurate figures would be, but I saw that out of 20 million manufactured dosages, Russia has exported 4 million. And there were no problems for a while, but then they just started raining. And Brazil said, we don't want Sputnik. And then Slovakia said, we have questions about Sputnik. But instead of just politely figure out what the answers would be to the regulators, Russia started mocking these countries and saying that this is just Russophobia, nothing else. It's a political issue. There is no problem with our vaccine. So that's where we stand right now. And for Russian people who would love to have a good example of actually Russia doing something good for the world, that is in question right now, with all these countries having their doubts and be skeptical about Sputnik V.
Mm-hmm. Wow. And if the Financial Times is to believe, some EU diplomats in Moscow have also got the Sputnik V vaccine. Anna, as you well know, under President Putin, Russia is trying to return to greatness, and it has been expanding its, shall we call it, territorial footprint, Crimea, Donbass, and elsewhere. I believe the number is in Donbass alone, a few 100,000 Russian passports have been distributed. Have those people been beneficiaries of the Sputnik vaccine?
This is a very good question, Michael, because on the news, of course, we hear a lot about Americans mistreating these countries who once believed in them, not under President Donald Trump, Ukraine, for instance, did not receive the immediate help with the vaccine, right? And of course, that was on the news a lot. And we heard lots of reports about AstraZeneca having problems, Pfizer not being quickly delivered to European Union countries, while all Russian state agencies were praising Sputnik V. But as for Crimea, for instance, there is still shortage of supply to the peninsula of the vaccine, while thousands and thousands of dosages travel all around the world. Around 60 countries are expecting Sputnik today. Around between 50 and 60 countries. So I'm not sure about Donbass. As you know, there is no information, like we cannot travel there. We cannot report stories from Donbass. We cannot be physically on the ground. Unfortunately, I worked both in Donetsk and Luhansk regions during the war, crossing the front line back and forth for 2 years, but then boom, they close the door. We cannot figure out what is actually happening on the ground there. How many people were sick, how many people were suffering. And obviously we cannot count how many of them received Sputnik V.
Okay, thank you for that. And we should remind our audience that the number of conflict zones around the world are actually increasing or they're worsening. And one of the reasons for that is the lack of physical diplomacy going on right now. And of course, typically what happens in conflict zones, the health systems collapse, people don't get vaccinated. Professor Tsang, thank you very much for your patience. I saw you on a frontline panel about a year ago, I think it was. We were in the first months of the pandemic, and I remember you helped popularize the term wolf warrior diplomacy when it came to China. I wanted to ask you, the latest numbers out of Oxford Analytica, up the road from you, is in China, just 16% have been vaccinated, but they're aiming for 40% by the end of June. And it's, as you know, approved all 5 vaccines, all domestic. Now, China has sent vaccines, again, according to Oxford Analytica, at no cost to 69 countries. And by the way, most of them seem to be Belt and Road Initiative clients, and exported on a commercial basis to 28 other countries. So that's a lot of countries to get free vaccines. Have we perhaps misread the Chinese Communist Party heart under Xi Jinping? Perhaps they have a humanitarian heart and are all about spreading fraternalism and goodwill.
Well, I don't think we should be surprised that China would be engaged in vaccine diplomacy. Xi Jinping has made it very clear he will make China great again. And if he is going to make China great again, there is a domestic angle, there's also the international angle. And more often than not, we really are looking at the international angle. Now, with the rest of the world in such a mess, particularly the democracies, what better time than now for China to be exporting vaccines with the virus under control domestically in China, so it's relatively safe and it's easy to persuade Chinese people that exporting vaccine is not at their expense. And so Xi Jinping can do that. I think there's another important consideration, which is that the virus started in China, but the Chinese government would like the world to rethink and acknowledge that the virus did not actually start in China. And what better way to show that the virus didn't start in China than by showing how much China has been able to contain the virus and been helping the rest of the world to cope with the virus. And why would people still say that the virus started in China? It works, doesn't it, from their perspective?
Interesting. So is part of the effort here not only showcasing China's technological prowess, especially when it comes to pharmaceuticals, but also after, okay, I heard what you said, but after the debacle of the early handling of the outbreak and the things like mask diplomacy, that was another debacle. Is China aiming to be remembered for its helpfulness rather than for its neglect or negligence?
Oh, absolutely. Xi Jinping, again, made it very clear to Chinese officials and diplomats that they must tell China's story well, which essentially means that the version of events that the Chinese government would like to put forward must be put forward effectively. And this is why it is so important for them to engage. Now, there is also the more practical dimension that a lot of the free vaccines are being sent to the Belt and Road Initiative partner countries. And that is to cement their support for China so that in all the international organizations that might have a discussion on it, there will be plenty of friendly voices appreciative of this support of the Chinese government. So that kind of also works. And I think it's also very important to not forget the contrast with the failure of the democracies to deliver vaccines to other countries, notwithstanding their rhetorics about supporting human rights and all that. And in the end, the Chinese government is putting forward a case that you all criticize us about our human rights, but we are the only one of the very few countries that is looking after the human rights of people in countries that they cannot afford the vaccine.
Yeah, well, let's see if they look after the people in Paraguay, who I understand are under quite a bit of pressure to accept the vaccine. Thank you for that. We'll come back to you, and I'd like to, hopefully we'll have time, go back to you and also to Anna. There's quite a bit of, shall we say, impolite rhetoric coming out of both Beijing and Moscow in terms of COVID. The Chinese Foreign Ministry once again blaming the United States for COVID. And then I also noticed Russia was criticizing Western vaccines. But before we do that, Dr. Madad, coming back over the Atlantic, we had a question from Jenny Humphreys. And the question is, what is the view on the need of or impact of vaccination passports generally, and also in relation to the impact on countries reliant on vaccine donations?
Well, I think first, vaccine passports, it's not a new concept. You know, we've done this on a lower scale when we talk about yellow fever, but this is talking more on a digital type of vaccine passport that individuals can have that shows proof of immunization or proof of a negative test for COVID-19. The way that I tend to look at it is, and this is actually from a colleague, Dr. Scott Giebelhaus, who mentioned this analogy, and I think it's very fitting. If you've ever been to the United States, or if you have in your highways toll booths, right, where you have to stop and pay for the toll to go on a highway, that's how I think in one way we can look at vaccine passports, where you have a fast lane. If you have an easy pass, you're going to just kind of, you know, swift right through it rapidly because you've been vaccinated or you have a negative COVID test. And those that don't have it will have to go through the slow lane and pay the toll and go through that process. So that's how I look at it. I know there's many different challenges that are associated with it. It's a very complex problem because when you also look at it from a digital standpoint, privacy, cybersecurity are up in front and center. We're already seeing so much fraud in terms of people having these CDC cards that show that you're fully immunized. You know, you're able to buy them off you know, the World Wide Web. So there's a lot of challenges associated with it. But I think that if this is a concept that we're able to utilize more on the basis of having a fast lane, then I think we can build out a proper process worldwide, but not something where we have to, where we're looking at it, where it's going to be a detriment, where if you don't have it, you know, it's going to have limitations. So I think that's one way that I would like to kind of look at it in that sense. It's also kind of an incentive for individuals to get vaccinated. We want to promote vaccinations worldwide to have as many people vaccinated. We know vaccine hesitancy, not just here locally, but around the world is at its all-time high. There's a lot of misinformation, disinformation all around the world. So if we can counter that with having incentives like that, I think we can build it into a more positive frame.
Okay, thank you. And yeah, I've noticed for several months already, Dr. Tedros and Dr. Mike Ryan at the WHO have been really pushing back against these vaccine passports for a number of reasons, but the main one being that it causes stigmatization of those that can't get it. Teri over in Brussels, what is the view there on the ground with these vaccine passports? As you know, a lot of the economies are very keen to readmit travelers. I see Spain being very eager, of course. What are you hearing on the ground there in Brussels?
Yeah, and Greece has already said also that it will allow tourists back. What was mentioned there about not just stigmatization. Here, there's not that much anti-vaccine sentiment, but what there is a backlog of people who can't get it. Here in where I live, just outside in a Brussels suburb, they're still on the over 65s. So, you know, even though the EU said that they wanted to have 70% of adults vaccinated, they always say by summer and don't specify whether they mean the beginning of summer, which is what people want to hear, and the end of summer, which is completely different. They are not moving quickly. Even here in Belgium, where there is, you know, a huge production facility, they don't have a supply. They can't get it. People cannot get vaccinated at the moment, no matter how willing you are. And even when I step back and I'm not thinking like a journalist, that offends me. That offends me that I can't get vaccinated, that people may be able to travel, that I would be just as willing as anybody else, but I can't. So I think there will be a lot of, there will be a lot of, I would say, resentment in Europe if tourists can start coming and people can't travel to their own, can't travel even within, at the moment, even within our own countries, we have been blocked from traveling. Even, so there are some still some very serious restrictions on people traveling here, and it will be a balance between wanting to bring in some tourist money and wanting to travel ourselves.
Yeah, and speaking of that, Turkey is just going into its first nationwide lockdown. People are only allowed to go out for very essential reasons, but they can't travel intercity, and yet the country is still continuing with destination tourism from overseas. So, Anna and Professor Tsang, we have just the most wonderful question here from a viewer. It's anonymous, but let me read it to you, and perhaps we can start with Anna. A huge success of Serbian vaccine diplomacy has been widely acknowledged, and its purchase of Chinese, Russian, and Western jabs reminds of the golden days of the non-aligned movement in the 60s. Do you think the Serbs are right about asking what the price the country may have to pay for its vaccine success? Anna, can we start with you?
The price for the vaccine success? You mean for the choice that they
exactly?
Made?
What is expected perhaps from them in return?
I wonder if the anonymous listener is skeptical about all the three vaccines he's mentioned. Well, I can only say that so far, from what I can see around me, from people who get vaccinated, and by the way, in Moscow, they pay you for getting vaccinated. Teri, can you imagine that? You can get your jabs done in a mall, at a clinic, this is just like a big, huge market where you walk in and get your job done. But people...
They may not accept those. So that's one thing I should mention. Sorry. And then the European Union is saying only the vaccinations they have approved will count for the travel. So
yeah, of course.
I wouldn't be able to come home, but I would get my jabs.
So far, out of European Union countries, I think Hungary is the only country that is giving Sputnik V vaccine, and they claim they're happy about the results. From what I can say, looking around, everybody seems to be happy about the results. There were a few scary stories, but not too many, and people feel pretty brave after getting the Sputnik V. We'll see. Time will show. Time will show. People in Serbia, I'm sure they have neighbors hungry to look at and judge by their results, by their example. So all the best luck with the vaccines in Belgrade.
Okay, Professor, you already talked a little bit about the recipient countries and perhaps what's expected of them. For sure, no criticism of human rights record, supporting Chinese plans on Taiwan, South China Sea. What else should these countries be wary of when it comes to especially accepting free vaccines from Beijing?
I think one of the biggest problems with the Chinese vaccines is that we don't know how effective they are. There's not enough transparency for us to be absolutely certain of the effectiveness. So if in the end, the vaccines are not as effective as the Chinese government says they are, and you act on the basis that having had 1 or 2 doses of Chinese vaccines and you are safe, and you turn out not to be, then I think you will have to pay a very significant price. That will be a problem for Chinese people in China as well. It's not a problem that the Chinese government is deliberately exporting to others. I think it's a problem with the system that the top leadership has declared that vaccine is so important and vaccine diplomacy is so important that nobody is allowed to go and examine and potentially challenge the effectiveness of the vaccine. Then we get into that kind of problem. I see that as more of a negative problem than any of the strings that the Chinese government may attach to any recipient countries in terms of what diplomatic responses they need to make. Those, you know it, you know what you are signing up to, and you decide what to do. This you do not know.
Yeah, okay. And Anna and Teri, all I got for getting vaccinated is a free popsicle from the pharmacy, but I'm not complaining. I was happy to get it. Dr. Madad, there's a fantastic question here from you, from Ewan Grant in London. And the question is, are there any signs of early progress on producing countries and manufacturers cooperating more commercially or non-commercially? For example, testing the effectiveness and durability of dosing with different vaccines?
Not that I have seen, but I'm certainly not an expert on the supply chain and how they're developing these COVID-19 vaccines on an international scale. So some of the panelists maybe may have some more insight on that. So I'll pause and see if they have anything to add to that.
Anyone can take that?
I don't know about again, not so much about the supply chain, but more just in general about the COVAX facility that the WHO has. And going back to diplomacy, the European Union, of course, helped set COVAX up when the United States was not willing to do that in the Trump administration. So they put themselves out as being very humanitarian minded. And, you know, we had these fundraisers with concerts and movie stars. And yet when it came down to it, when the vaccine, when the production lines started getting strangled, COVAX wasn't getting much either. I mean, it really came down to the ugly situation that countries are going to take care of themselves first. And until, you know, and then leaders even started saying it aloud, until our own people are vaccinated, we don't want to see the exports to other countries. And the EU currently has an export, they're not calling it a ban, but they can control these countries' exports outside the EU until they have fulfilled all of the contracts inside the EU, which they haven't. So the grandesse was pulled back pretty quickly, and that's sad to see, and that's dangerous for everyone, as we all know.
Okay.
And I'm just gonna, I think the one thing that I'll
yeah.
just, sorry to add, and I think just to switch that question a little bit more on even the lens of preparedness and why, as we kind of look out into the field and see that epidemics and pandemics are events that are going to continue to happen unless we have better strategies and infrastructure and systems in place. The one thing that I think is really important, and I've highlighted in many different forums that I've been on, is our entire strategy has always been just in time. So, you know, just in time, we're building manufacturing capacity, developing, you know, different resources, looking at scaling up workforce, things like that. And even genomic surveillance, everything has been done just in time. And we need to pivot from that to a just in case approach. So we know that just in case these epidemics or pandemics are going to happen, which we know that they will, we need to have better processes, systems, and infrastructure in place. And so when we look at from a global standpoint, to make sure we have these manufacturing capabilities strategically placed throughout the world, like in the continent of Africa, where we're able to develop these vaccines in a much shorter time frame. And the last thing that I'll also mention is that we need to look at, you know, vaccine development in a preemptive fashion, right? And so the World Health Organization puts together this wonderful list of priority pathogens, and they have everything from viral hemorrhagic fever to severe respiratory disease to disease X. And so, you know, there's a estimated price tag of just $4 billion to preemptively develop these vaccines for these pathogens. And if we actually look at the cost of COVID-19, just for example, in the United States, there's an interim price tag from October that shows that we're spending about $16 trillion, from the ramifications of this pandemic just in October. So if we just spend a fraction of that, we would be in so much better shape. So we definitely need to look at it better from a preparedness lens.
Okay, thank you. Anna, you might be in a position to answer this from David Short. Do we know if Russia is helping with vaccines in Syria? Maybe we can broaden that. And you talked a little bit about Donbass, but other theaters where Russia is involved in.
Well, I'm sure that all Russian allies are in the process of negotiating some sort of deals for Sputnik V vaccine. So far, this is the only vaccine out of 3 vaccines that Russia has available for its own citizens. Sputnik V is the only vaccine that is being exported. And Russia is not hiding the fact that it has a target audience, and that is all the allies, political allies. And most of these political allies are at odds with the West. But there is also, of course, this feeling that there was an attempt to create some sort of discord in European Union and Hungary was an example. When Hungary started vaccinating its own citizens with Russian vaccine Sputnik V before European Union has even approved the quality of Russian vaccine, that created a sort of tensions. People probably looked at Hungary and thought, this is unfair. We're still waiting for the green light. And it seems to be the goal. That seems to be what Moscow is aiming to.
Okay. Dr. Tsang, there's a lot of talk, as you've been hearing, about countries cooperating as we go forward. This will certainly not be the last pandemic. But having said that, as you know, under Xi Jinping, there's a very big effort to grow China's technological prowess, especially in the areas of chips, getting ahead of Taiwan on that. But there's also, correct me if I'm wrong, it seems a tendency to turn more inward to develop vaccines and other products for its own population, and for also pushing out foreign companies, hopefully getting their IP, but pushing them out. What's your take on that?
Well, Xi Jinping wants to make China into a genuine innovation superpower. And to achieve that, China will have to develop indigenous technology and innovation. It cannot rely on Western technologies and innovations on a long-term basis. But reality is that China is still quite behind in terms of the technological advancements and innovations. I think the case of Huawei is a very good example of showing how much of a national champion of China that was being seen as a world-leading company can get into trouble so quickly simply because of the American withholding of certain chips for Huawei. It shows how dependent they still are. So Xi Jinping would like to have the cake and eat it, but it is getting more and more difficult because China's more assertive approach is getting countries in Europe and in North America much more concerned about China, and therefore much less willing to share the technology with China, which they were previously remarkably willing to share.
Wow, fascinating. Dr. Madad, I think you and I have talked about this a few months before, but the role of WHO, as you know, its main tool is moral authority. It doesn't really have, under international health regulations, the teeth to censure countries if they don't comply to certain things. And from the start, WHO has been discouraging things like travel and trade restrictions, but I think it's fair to say, at least the wealthier club of nations have gone the other way on that. They have imposed restrictions. For someone like you who has spoken so much about the threat of pandemics and that we lack preparedness, does this worry you that going forward, if we don't have a strong central health body on this planet that it may cause us problems later on.
Absolutely. And I think World Health Organization certainly is a good forum to make those types of conversations and decisions. And we just need to make sure that we're providing more resources to the World Health Organization. It is underfunded, understaffed, under-resourced. And since we have this central body, I think we need to do a better job in utilizing its expertise and efforts to have these types of conversations. One thing that I'm a big proponent of is not reinventing the wheel. We're in these situations where time is of the essence. And so there's no reason to create multiple different bodies when we have some, like an organization like the World Health Organization that we can utilize in this fashion. We just need to make sure that we're providing appropriate resources to it to make those types of decisions. And there's a lot of conversation around that to make sure that those types of efforts are ongoing. But I think we just need to do a better job at it.
Okay, thank you for that. Teri, how about your take on things? A few short weeks ago, there was a treaty actually proposed on pandemics and on vaccines, getting the wealthier countries at least together to cooperate. And I think China was even a signatory on that. But do you see a kind of wake-up call among blocs, among diplomats, among leaders that, my gosh, look at the mess we're in globally, and we should coordinate much more closely in the future and put our disagreements aside?
Well, certainly, but even inside the 27, they can't do that. So yes, everybody thinks that would be a better idea, but once again, where the European Commission really wanted to be the sort of leading voice on this, and for people who don't know, there's sort of three branches of the EU, kind of like there is in the US, the European Parliament, the European Commission, which can propose laws and which is the executive body, and the European Council, which is the representative of all the 27 governments. So the European Commission is sort of the worker bee here, and they wanted to and got permission from the member countries to be the coordinating body, for example, on signing the contracts with the vaccine producers. And that really fell apart. That has really fallen apart. They have no support. Ursula von der Leyen, the Commission president, gets blamed personally all the time for these contracts that are not being fulfilled. So when you see so much disunity, and it's not going to be over, as Anna was talking about, using different vaccines, as soon as the Hungarians can't travel because they dared to use the Russian vaccine, this is just going to get more bitter. So I think that there were some efforts early on to coordinate internationally. And I think at the WHO, I mean, the EU is a very fervent supporter of the WHO, and it's a both financially and morally. So I think that they're satisfied to leave the stewardship at the WHO, but I don't know, things look bad. And like I said, when the Europeans certainly can't get on one page, it's really nasty. A lot of the vaccine non-diplomacy, it's pretty ugly in Europe. And then when you throw in against the UK, I mean, blocking the exports, if the AstraZeneca and others had facilities inside the EU, then you couldn't send them to the UK, because there's still all kinds of Brexit angst. So, I mean, it's nasty. It reminds me, I think I told you this, Michael, it reminds me of the financial crisis days when, certain countries were looked down upon, certain countries were drags and other countries were, the providers, and it's really bad. But when you've seen the countries like Germany do so poorly on the vaccine rollout, on stemming the crisis, stemming the infection rate, it's still very bad. And France, the big guys are not doing well. There's not much leadership on the health crisis. Really, it's coming from nowhere.
Yeah, well, the lack of political will is certainly something we're seeing here in Canada, as well as more parts of the country go under lockdown. Kind of to start wrapping up, because we have run out the full hour with this fascinating discussion. Anna, just quickly to you, there's a question on whether any countries are sending vaccines to the Palestinians in the West Bank and Gaza Strip. Do you have anything on that?
Yes, I saw a bit of news back in January that Russia was going to supply a little bit over 100,000 doses to Palestine. And I just checked, and Russia is planning to supply Sputnik V to Syria. And as you can see, the small, deliveries, just 100,000 doses, but it is a gesture. It is definitely a gesture of diplomacy.
And just quickly, speaking of gestures, did Russia offer also Sputnik V to Ukraine, who, of course, it's pretty much at war with at the moment?
Yes, they did. I don't think that Ukraine accepted the offer.
No.
No, but the two presidents are now in open talks about their meeting somewhere on the neutral territory. We'll see if that's going to happen.
Yes, exactly. All right. Well, thank you for that answer, and to all of you for your answers. I think there's still a lot of questions in terms of the kind of what underpins this vaccine diplomacy. Where will we end up in a few weeks or months from now? I think we all hope that these variants will not get the best of us, because it does seem a little bit that this virus does have the ability to outsmart us almost at every corner so far. So hence, that is why international coordination is so important right now. I will put out this thought to you. Open secret, I'm working on a book on COVID-19, but one of the things that has really struck me is that a lot of the victims, especially early on where older folks were succumbing to illness or death, were actually people who survived famine, wars, migration, Pol Pot, people like that, the Holocaust. And yet it's near the end of their lives and their retirement ages, COVID-19. So the reason I mention that is I know there are a lot of people listening around the world who are maybe questioning the protocols and whether to get vaccinated, but we should remind you actually that this is a very, very deadly vaccine. Do everything possible to protect yourselves, and we wish everyone safety. So again, thank you to our distinguished panelists, Anna in Moscow, Teri in Brussels, Professor Steve in London, Dr. Madad in New York City, and of course to Yogita Limaye in Delhi for that very informative report at the beginning. Thank you also to the Frontlines Pranvera Smith and her wonderful team for putting this all together. Don't forget to subscribe to the Frontlines YouTube channel, follow us on social media, and of course, when conditions allow in London, I'm sure Pranvera and the team would love for you to come to the club in person in Paddington for great events, friendship, cuisine, and drinks. And in the meantime, there'll be more events coming up virtually, and they'll be advertised on the website. I'm your moderator, Michael Bociurkiw. Stay safe and see you soon. Bye-bye, everyone.
Thank you, Michael. Thank you, everybody.
Thank you and goodbye.
Bye. Thanks. Goodbye.